My name is Dr. Danья Suraj. I did my BMS in SDM Ayurveda College, Udupi, which is in Karnataka state. I finished my degree during the year 2000 to 2005. 2006 I passed out. My grandparents all were related. They are having the connection with Ayurveda. All are like my grandfather is not a doctor but like a Vaidya in Ayurveda. He was the one treating the patient with Ayurvedic medicine only. So, in the same way, my mom is working in this same field only, like Ayurvedic. She was a senior superintendent of she was working as a senior superintendent in district medical office, like Indian system of medicine, related with the Ayurveda only. So I was having a family background with Ayurveda. That's how I came to. Now I'm teaching here the basic principles, which we taught first in the introduction of Ayurveda and basic principles. The treatment is mainly dealing with the basic principles like Tridosha, Saptadhatu and Trimalas. These all are the basic principles of Ayurveda.
Can you speak about them?
Three dosha means these are the main called three basic constitutions of the body, like Vada dosha, Pitta dosha and Kapha dosha. Like if there is any imbalance in this, if any one of these increases, any one of the dosha increases, then the person will be suffering from any kind of diseases. If either increase or decrease of these three doshas is there, then the patient will be suffering from diseases. But if everything should be in normal stage, then the person is considered as a healthy person. The aim of the Ayurveda is to cure to maintain health of a healthy person and to cure the disease of a deceased person. This is the main aim of Ayurveda. Saptadasu, those are Rasa, Rakta, Mamsa, Medha, Majja, Asti and Shukra. These are the 7 dhadus. Without this thing, a person can't live. Everything should be there. Then 3 malas. Malas are considered as a waste product. And one more thing we told, that Agni. Agni means that digestive capacity. If digestive capacity is impaired also, then everything will be affected, If proper digestion is not taking place, then what we will tell now, after digestion, nutrient parts and waste products is formed. No, nutrient parts, our body is taking that nutrient parts and the waste products is expelled out. So everything should be in a proper way. That's what we think. So Tridosha, Saptadhatu, then comes the 3 malas. 3 malas are the waste and Agni is the digestive power. These all are the basic principles. According to Ayurveda, the diseases is mainly because of the imbalance in the Tridoshas or Dhadus, Saptadhadus, or in the Malas or Agnis. These are the main basic principles, and these are the if there is any imbalance in this one, the person will be suffering from the diseases. And in Ayurveda, we are treating with the medicine or with we are treating in the lifestyle, some modification in the lifestyle, in Ayurveda it's clearly mentioned about the dinacharya, what all thing you have to do in a day. Then again in Ayurveda they have clearly mentioned about Trudacharya, in this in a particular season what you have to do and what you are not supposed to do, what all thing, in not only the activities, including the food habits also. So diet modification is there. The same way about lifestyle is there, and remedies like herbal medicines we are giving, internal medicines, like the medicines which is prepared out of herbs, Then like in the same way, then cleaning cleaning processes like panchakarma, going for panchakarma. This is how we can cure the diseases. Yoga is part of Ayurveda only. These all are the remedies in Ayurveda. Along with the medicines, these all things you have to follow. Lifestyle, diet, then yoga, then panchakarma for a proper relief from the disease or cure. Actually, in Ayurveda, we are not supposed to use the word massage. Massage means oil application. The same thing in Ayurveda, we are calling it as abhinga. This is considered as a pre-procedure. Before going for the panchakarma, you have to go for pre-procedures or purva karma. It's called as a purva karma, to make the body soft and to make the vitiated doshas to come to near the channels in the outer layer, so that it can be expelled out easily or through panchakarmas. Panchakarma is considering as a cleaning process. So you have to aggravate all the doshas, then you have to take everything towards one place and it should be thrown out. So my treatment experience was starting from the starting itself. After completing my BMS degree, I was treating a patient. The first success is one which is dealing with the degenerative diseases of eye, and that lady, the complete loss of vision was there. She can't see anything. So this is related with the degenerative diseases of eye. So all the doctors rejected her. They were telling there is no treatment. So when she come to me, so I was working as a doctor, medical officer as an RMO in a hospital. So my CMO, chief medical officer in that hospital, he asked me whether are you ready to go for a tarpana, netra tarpana. I told I'm ready. So we started with the netra tarpana, that akshi tarpana means pouring medicated oil. We will make a wall around the eyes and we will pour a medicated oil in the eyes. This thing is good for eye problem. So along with the internal medicine, we gave this one, and after 7 days, she can read that big letters. So I think it's a great success of our science, Ayurveda. The same way, next is recently, I was treating a person who was fallen from the tree, and the problem is related with the vertebral column. So he was not able to walk, or he was completely bedridden for last 11 years. He have gone for all type of treatment, but at last he left that. He told that he can't get up from the bed. So he was completely bedridden for 11 years. So after 2 months or 3 months treatment, he started to walk. With the help of, not without help. Now he can walk with the help. He can catch somewhere and he can walk. According to Ayurveda, we have two varieties. One is curable and incurable. These are the classification of diseases in Ayurveda. For example, diabetic. Diabetic is a manageable disease. You can control, but you can't cure the disease. Diabetic, So in the same way, some diseases are, even in Ayurveda, some diseases are considered as incurable only. But some can be curable. The one which we can cure means which started recently, or we have only less symptoms. And even the patient have more strength, not only more willpower, and both mental and physical strength is more, than we can cure. But some diseases is considered as incurable only. So we can't cure any incurable diseases.
You would cure yourself with Ayurveda?
Sure. Not only me, my son also. Even not only me, myself, my husband is also an Ayurvedic doctor. He's working as an Ayurvedic doctor, not here, he's working abroad. Muscat, Oman. He's working, Oman, UAE. It's like Muscat. So he's also an Ayurvedic doctor. So being a son of a doctors, two doctors, we can't.
He will be also
I-
doctor?
Yeah, that's it's up to him. It's up to him. He can select. Like, but we took a oath, like whatever. We decided that we will never give any other medicine. We will cure everything with Ayurveda. So till now, we are treating everything with Ayurvedic medicine only, and we both are taking only Ayurvedic medicine.
How old is he?
How? My son
Yes.
is 6 years old.
It's very
Small.
He is very young.
Yeah. But till now, even like we are giving, I didn't give any vaccination, like polio vaccination. We were giving on the Ayurvedic medicines which were explained in our text to increase the immunity power.
And Oman is Arabic?
Yeah, Arabic.
state?
Yeah.
And they also have Ayurveda?
Yeah.